hello friends. This question: the infant Jewish boy of Eastern European descent has not reached developmental milestones. He is a Jewish boy who has not reached developmental milestones but also has minimal neurological function and blindness. The microscopic examination of neocortex is seen. What is the diagnosis? The carrier rate of genetic disease is 1 in 30 in population of Ashkenazi Jews. The diagnosis, see in here, if you see, there are many pale neurons are seen. This is a pale neuron, this is a pale neurons are seen in the cerebral cortex. So this is a Tay-Sachs disease. This is a picture showing Tay-Sachs disease. The carrier rate of Tay-Sachs disease is 1 in 30 and the zygote can affect almost 1 in 60. What may account for different clinical expressions of the same gene? Different chemical expressions is due to hexosaminidase A mutation. Thank you for watching.